Well, the National Taxpayers Association, together with the Ministry of Health, released a report today showing what is happening in the counties with regard to health. And this is what was said this morning.
Staffing levels were extremely low at our health centers. Challenges with this 24/7 is that the lab is not open, issues like that. And that was attributable really to understaffing.
NTA is a member that tries to put together, create standards, create opportunities, build knowledge, and become a repository of knowledge on social accountability, and therefore, be able to implement across the board the issues of social accountability so that services can become accessible, responsive, and really people-driven.
Well, Martin Napisa from the National Taxpayers Association is joining me this afternoon. He's a national coordinator. Thank you for joining us. So what would you say was the key finding from this report that you had with the Ministry of Health?
Thank you, Edith, and thank you for having me in the studio. One of the key findings that we found out in the report is that the Ministry of Health has been, underfunded, and for a long time. We've seen a situation whereby, there are government commitments in terms of, increasing resources to the health sector. Abuja Declaration, for example, it indicates that, the government is supposed to allocate up to about 15% to the health sector. We've seen we are an average of about 4.6. When you compare Kenya with other African countries, we realize that Kenya is performing dismal. Some of the countries like Uganda, like Tanzania, they're actually allocating a lot of resources to the health sector. And as a result, we find that, we don't have enough staff. On average, when you look at the level of the health facility that we looked at, that is level 3, we are supposed to have about 43 staff per health facility. But we are having some health facilities which, with as low as 12 staff members. And surely in terms of service delivery, they are strained.
Yeah.
You look at key services like, for example, maternity. Health facility cannot operate 24 hours because, you have very few staffs who are, overworked. They cannot be able to, operate and serve the Kenyans the way they are supposed to serve. Secondly, we have the issue of drugs. When we say health care is free, it means that a Kenyan citizen, a Kenyan patient is supposed to get drugs and everything at the health facility. What is happening is that you go to the health facility, then you are given a prescription, and you are told to go and buy from the chemist. What it means that you're having a double waste. One is that you are spending a lot of time going to that particular health facility. Then you are not getting the medicine that you require. You are told to go and buy, after waiting, of course, for a very, very long time. So that is causing a very big challenge. But we have also seen the health facilities missing some basic things like even electricity. We've seen a situation whereby an X-ray machine is not operating because that particular health facility does not have electricity. Those are basic things.
Well, you're obviously talking about issues that health workers have raised, especially when they threaten a strike. But in the story that we just had, we're being asked for social accountability. How can the public get involved in this? Because every time there's a strike, we look at the doctors and we're like, oh, come on, you're letting people die.
That's a very good question. And public participation is one of the key issues about the Kenya Constitution. Public participation, the health sectors, when you look at every health facility, it has a committee we call a Health Facility Management Committee, which has a representative from the community. And this committee is supposed to look at the management of that particular health facility, incorporate issues from those particular community members. But what is happening is that these committees have not been trained for them to be able to engage the community. They are not being facilitated. So they are just formed and they're just there. And without knowing your mandate, you cannot be able to do anything.
So what's the way forward? Because you're saying that there's hardly any funding into the health ministry, but as a taxpayer, I don't want to feel the extra pinch of increasing more taxes so that we can be able to afford these services.
For me, that engagement between those particular committees with the community is important enough. We've seen cases whereby engagement with the community. Once the community understands the problem of those particular health facilities, they are able to appreciate And sometimes they contribute even in kind. We've seen situations whereby, you go to the hospital and you find the hospital doesn't have even water. As a community, you can participate in one way or another for you to be able to improve service delivery like water. And, that interaction between the community and, the health facilities, it makes them understand the problem that that are going on in those particular health facilities. At the end of the day, when you see maybe a staff, a nurse, dosing when she's supposed to be serving people, you understand that she was maybe working overnight and you expect services during the day. So when there's an understanding between the two groups, the nurses at the health facilities and the community, then there's that harmony. Instead of blaming, of course, you know what is happening. If it's the problem of understaffing, you know what is happening and you appreciate,
All right.
Yes.
Okay, unfortunately, we do have to wind up there because of time, but Martin Apisa from the National Taxpayers Association. Let's have a look at sports now and begin with rugby, where the 3 Kenyan teams to